Welcome to Spectrum Medical Imaging. This is the home of Sydney's imaging specialists. What differentiates Spectrum from other medical imaging practices? Well, it's the staff. The staff at Spectrum Medical Imaging are unique. They're all hand-chosen, they're all colleagues and they're friends. Most have been with Spectrum since they started their careers, be it in reception or technologists. Our reception staff are skilled at understanding what patients need when it comes to booking a procedure. What time, the difficulties of life and fitting in with kids or getting grandparents in from the nursing homes to have their imaging tests. The reception staff at Spectrum offer a smiling face to patients as they arrive. They also offer a kind voice over telephone. These staff have been well trained. They are caring people. They know how to book an appointment at a correct time for patients, listening to their needs. Our technologists are superbly trained. They are specialists in their own right. Some only do breast imaging. Others are experts at ultrasound, CT scanning, MRI. All of these things require nuances of training that most people don't realize. They've also spent a lot of time studying and continue to study. The radiologists or the imaging specialists at Spectrum Medical Imaging are unique as well. They work in public and private hospitals. They understand the breadth of medical care but also remain focused. They are specialists in their own right, well known in their field, specialists in cardiac imaging, breast imaging, women's health, men's health, whether they're involved with oncology or trauma, orthopedics. These are all names that our doctors have to cover on a daily basis. The Spectrum Medical Imaging practices are across East and West Sydney. They offer a broad range of imaging modalities, from simple X-ray to complex CT scans. We offer MRI, ultrasound. We've got the latest tomosynthesis, which is an advancement in mammography, making it more comfortable for women to have their breasts imaged. Women are often horrified of the thought of a mammogram, but the new tomosynthesis machines are far more accurate. They can show us lesions when they're smaller. And this means that over 99% of people who've got a cancer less than 1 centimeter are looking at a cure. This is important today. Not many practices have the equipment that we have. We've invested heavily in technology. Spectrum Cardiac Imaging is our newest addition to the family. It's made up of a booking process, a preparation process, scanners that deliver high quality imaging at a low dose, but more importantly, it involves a whole team, from technologists who know the scanners to the cardiac radiologists and cardiologists who are also imaging specialists. All the scans are double read and patients feel at ease. We have the latest in cardiac CT technology. Spectrum Medical Imaging has invested a lot in technology, and this is best showcased by our latest CT scan, the Revolution CT from GE. This CT scan is unique. Spectrum was the first to purchase this machine in Australasia and was the first to install it in Australasia. We've also helped GE develop their apps. What's unique about this CT scanner is that it offers and delivers results. This scanner is the fastest in its class, delivers low-dose imaging of the heart and any part of the body. For example, we can scan the head in less than a second. We can scan the heart in between heartbeats. It looks like a piece of furniture. Beautiful wood surrounds, a wide bore, a lot of ambient light, and it makes patients feel comfortable. When a patient's confronted with a cardiac scan, they're often anxious, and that's not good for us because we'd like a heart rate that's low. And why that's important is that in between beats, we take in the scan. So when patients are confronted with a scanner that looks comfortable, patients feel at home, they lie down, they're much more relaxed, their anxiety is less. The scan also shows their name as they walk in. That's also important for safety so that we convince we're scanning the right person. The scan also can show a little video on what the patient can expect. It also can show a video to keep them relaxed during the scan. And if their head's in the scanner for a head scan, if the patient looks up, there's even a nice paisley print with some hidden characters. Maybe they can find the umbrella in the maze. Spectrum Women's Imaging. Well, what's important today is early detection of cancer. At our centres, we have the latest equipment and staff that are trained and honed in on this one goal. So when patients come to our centers for breast imaging or ovarian imaging, our centers are designed to make them feel comfortable. They're greeted with a friendly smile. They're put into gowns that are comfortable. They'll have their scans done on machines that they can trust, offer low-dose radiation, but also the highest chance of picking up early disease. And if that means no disease, that's even better. Spectrum Women's Imaging Centers, we have the latest technology to image the breast. Tomosynthesis is a buzzword today. What it means is that we look at the breast in a different way. Traditionally, dense breasts overlap small lesions. As you can see, we now scan the breasts in a machine that doesn't compress the breast as much, but slices the breast in small, thin slices, less than the thickness of a credit card. And when you put these all together, we have the greatest chance of picking up these small cancers. And remember, if a cancer is detected less than a centimeter in size, you're probably looking at 99% chance of cure. Spectrum technology. At Spectrum, we have to develop software to talk to our machines, to make it easier for patients to find their results, for doctors to log in, see the images as they're taken. All of this is housed by this group. We've got talented individuals who write software, enable hardware to talk to iPhones, iPads, Android devices, you name it. We send USBs, CD-ROMs. We've got software that delivers results to patients at their homes. We've got software that sends results to doctors' rooms. Spectrum 3D printing. Well, 3D printing is a rage. What do we use it for? Well, we were actually pioneers in this. Our beautiful scanners that scan all body parts are now being asked to deliver 3D prints of your body. We currently print people's jaw, different parts of the skeletal system before they have orthopedic operations. And this makes surgery quicker, easier, safer. We're looking at many other things, printing livers for liver cancer prior to resection. This is a very exciting part of our field. Spectrum corporate imaging. We need to deliver a health package for healthy people. Why? Because it's actually quite stressful knowing or worrying about a disease that maybe your grandparents had or your father has. And we have some people who are constantly asking the question, do they have disease? Today, the radiologist with their latest equipment is able to delve into your body and give you the all clear. But what's different is that the old days of doing a whole body scan are gone. There's no such thing as a whole body scan. Each part of the body is unique. So when you need a scan or a group of scans or something to try and give us the information whether you are healthy or not, you actually got to tailor the examination. So our corporate imaging package is different. It's tailored to you. What are your risks? Are you different to other people? Yes. The imaging is tailored. You might have to have an MRI of your head, an ultrasound of your liver, a prostate MRI, a tomosynthesis of your breast, an X-ray of your foot, combined with blood tests, counseling, genetic testing. A package is what you need. Spectrum Medical Imaging offers this corporate approach to personalized healthcare. It's new in the environment of healthcare, and it's an exciting innovation. Spectrum Corporate Imaging is the new kid on the block. A health package is what you're after. Spectrum Interventional Radiology is what I'm really passionate about. And why is that? Well, I am an interventional radiologist. Every day I perform treatments for cancer, for pain, in the public and private setting. But importantly, patients who come and spend time with me are treated as individuals. Their care is personalized. When we treat someone in a public hospital, they need to be worked up before and followed up. Often this is done in the private setting in our imaging centers. At least patients have the confidence that the person who treated them is the person who's looking at their scans, seeing if the cancer's resolved or returning. How has the uterine fibroid responded to its treatment? Uterine fibroids are common in Australia, and uterine fibroid embolization is a growing field. But the workup MRI has to be done correctly, and this we do at Spectrum. Spectrum Men's Health. Well, it's all about the prostate today. Let's face it, that's a very important organ in a male. But what you might not know is how common prostate cancer is. At the age of 75, your chance of having prostate cancer is 1 in 7. At 85, it's 1 in 5. What's important today is early diagnosis without the finger. Well, you come to Spectrum Medical Imaging. Our latest MRI scanners will scan the prostate in a comfortable, low-stress environment, making it very easy to find early cancer or give you an all clear. What's also important is to understand that not all prostates have cancer. Benign enlargement of the prostate is even more prevalent. 50% of men over the age of 50 have benign enlargement. In fact, 80% of men over the age of 80 have benign enlargement. Well, this is also treated very effectively by urologists, and today prostate embolization is the new kid on the block. The MRI and the CT scans used for workup for this condition enable us to stratify patients who may be eligible for this exciting treatment. Our radiologists who look at prostate imaging scans, be it MRI or ultrasound, are specialists in this field. In fact, they pioneered the use of MRI in prostate. These results are forwarded to the urologists, who enable them to make accurate diagnoses of where to do biopsies, maybe less invasively. Spectrum Medical Imaging offers lung cancer screening. And why is that important? Well, lung cancer is one of the commonest causes of death in patients in Australia. And in fact, our scanners now can scan the lung at a very low dose, especially in patients who've got a history of smoking or have been exposed to asbestos. It's very important to diagnose early because earlier diagnosis means more effective and curative treatments. What's more, we can compare your scans to previous scans, whether they were done at Spectrum or at other practices. But in future, the scans can all be compared on our workstations by talented staff who have one specific goal, and that is to detect early cancer. Spectrum offers pediatric services. Spectrum Pediatric Imaging is tailored to the pediatric population. And why is that important? Well, pediatric patients or children have special needs. First of all, we have to choose modalities that do not expose patients to ionizing radiation. Young children are especially at risk for these complex tests. Well, our pediatric specialists tailor the tests and examinations to suit the child and also find the answers to the difficult questions. We also have staff who know how to deal with children. They've had a lot of practice. Our machines are quieter, they're more friendly to patients. In fact, our new MRI scanner in Randwick has a silent mode. It can scan a child's head without the typical noise of an MRI scanner, and that puts both the parents and the child at ease. Our pediatric specialists know all about the conditions that affect children, which are totally different to adults. Children's diseases are maybe congenital or metabolic, very different from cancers and cardiovascular disease. Well, our pediatric radiologists do this on a daily basis. They concentrate their skills on pediatric imaging and therefore have the experience to give you the confidence that your child's looked after. The imaging has to be appropriate. We don't want to irradiate children unnecessarily, and we need to choose the best test once to answer the question. Spectrum Dental Imaging. Periodontics require the best imaging of the jaw and the teeth every day. Well, what's different about Spectrum is that all our scans of your teeth, be it a CT scan or an OPG or a tomogram, are done on the latest machines, but more importantly, the radiologists that read those scans are specialists in dental imaging. These reports are tailored to answer the question about the jaw, which is totally different to other parts of the human body. Spectrum Dental Imaging has specialists who only report dental imaging. This gives the dentist or the orthodontist confidence that the scans or the x-rays that we take of your teeth or your jaw are confidently looked at and the right diagnosis is made. This has been very helpful for the diagnosis of quite uncommon conditions or common conditions of the jaw or the teeth. Spectrum Dental Imaging has cone beam CT as well as OPG, and we can use our CT scanners to scan the jaw. But what's unique about our images is that they are read by dental specialists. Our Spectrum Dental radiologists only report dental imaging. And why is that important? Well, when the orthodontist or dentist looks at the results, they want to know that the results have been interpreted by people who understand the mouth, the teeth, the jaws. And that's different to the rest of the body. Spectrum knows how to image orthopedics. Let's face it, the musculoskeletal system is an important part of your body, but the interpretation of those scans is even more vital when you understand how complex the anatomy is. Decisions on problems in the knee are completely different to those in the shoulder, the elbow, the wrist. In different age groups, different conditions affect different joints or different parts of the spine. Our specialists who report on these studies are specialist MSK radiologists. You can be confident that the results of the scans will help your orthopedic doctor or other specialists come to the right treatment for your condition. Patients with orthopedic problems, which might be joints or bones or fractures or trauma, all types of arthritis, are imaged uniquely at Spectrum practices. But what's more important is that the results are interpreted by musculoskeletal radiologists. These are doctors who've specialized in looking at your bones and your joints. Why is that important? Well, if one understood how complex a knee is, or a shoulder, or a wrist, you would want a specialist who looks at that on a daily basis to offer a result. And that's important for your orthopedic doctor because he needs to make some very important surgical and treatment decisions hinging on those images. Spectrum obstetric imaging. Well, that's probably the most exciting time of a woman's life, expecting a new child, but maybe also the most stressful. Our ultrasound machines and the operators, the sonographers, are specially trained to look at the developing child. We often have to find out how normal a child is, the sex of the child, but more importantly, are there any hidden conditions? Are there chromosomal abnormalities? Well, we have a package that looks at that. We look at the baby at different stages of the pregnancy, combined with genetic testing, blood tests, and other features allow us to diagnose these chromosomal abnormalities early, and that's very important. More importantly, the healthy child. Well, we offer 3D imaging of the baby. And why that's important? Well, it allows you to get a glimpse of this person who's probably going to change your life. That 3D image is given to the patient on a USB or CD-ROM or printed out on paper. It'll be the first photograph of your child, worth keeping, worth framing. Our 3D ultrasound service looks at the baby in a different way. It introduces this developing child to the parent in a much easier way, an understandable way. More importantly, it allows the doctors to look very carefully at the anatomy of the patient, of the baby, how the little hands are developing and the feet. But those glimpses of the baby are very important to the expecting mom. Spectrum cardiac imaging. Spectrum has a unique group of individuals in cardiac imaging. Cardiac radiologists and cardiologists who've specialized in imaging working together. How do we do this? Well, patients need to be treated individually. They're risk assessed and the scan tailored to their body habitus. Our scanners scan the heart in a single heartbeat with the lowest dose. Patients who have their heart scanned at Spectrum can be confident that the cardiologist will have an insight into what the vessels look like. Remember, cardiovascular disease is one of the commonest killers in Australia today. Everyone knows someone who's had a coronary artery blockage or a heart attack. Our goal is to find the disease before that happens. And remember, a normal cardiac CT scan has a warranty period of about 7 years. So remember, chest pain is very common, maybe related to anxiety, but it could be the first sign of nasty cardiac disease. Our scanners at Spectrum are used to look at the vessels. Why is that important? We want to find blockages early. More importantly, we also want to find people who have normal hearts. Remember, a person who's stressing out that they've got something wrong with their heart because their father had something wrong or their cholesterol's too high. Well, if they've got a normal cardiac scan, they have a warranty period of about 7 years. A clean bill of health of the heart is a great thing to know. Alternatively, we might find an early blockage that can be treated right now with medication. or an imminent blockage that might need a stent, or we might even find 3-vessel disease that needs a bypass next week. All our cardiac scans are co-read or double read. That means that they get a second opinion. The experts who look at your scans are both radiologists and cardiologists. You can be confident that the heart has been fully evaluated. We're looking for early disease, we're looking for normal hearts. Early detection of blockages in the coronary arteries is the only assurance of cure. At Spectrum, we always prioritize the patient experience, so we've invested in technology that provides a low-stress environment in order to make your CT scan a comfortable one. Enter our scan room and you'll be met with our Revolution CT, a scanner that looks more like a piece of furniture than medical equipment. With its wide open bore, ambient lighting and low operating noise, your anxiety should melt away. Your name will be emblazoned across the LCD display as one of the many safety measures we employ to ensure that we're scanning the correct person with the correct scan protocol. If you're new to having a CT scan, ask one of our friendly technologists to play a short video on the scanner that will explain what to expect from your procedure. Distraction can also be a valuable tool, so the scanner can play relaxing videos to keep you occupied. If you're having a head scan and the LCD is out of view, there is a patterned imprint inside the scanner that has hidden pictures in a paisley design. Can you find the umbrella or the butterflies? Of course, a CT scan is there to help your doctor make a diagnosis or monitor your progress. High quality results are therefore very important, which is why we made a significant investment into the most advanced CT technology available today. The Revolution CT uses an extremely low radiation dose, up to 82% less than older technology, and is capable of scanning your brain or your heart in less than a second, with slices that are thinner than your credit card. There is nothing that has been overlooked with the design of this CT in order to make your journey with Spectrum a safe one, a comfortable one, and a confident one.